Third Sector Referral Coordinator team was established in 2019. It was actually the brainchild of Clare Edwards, our Health Partnerships Manager. And it was initially a 12-month pilot scheme funded by NHS England to embed 2 third sector referral coordinators within 2 separate integrated care communities across North Cumbria. One was based in the Eden ICC and one was based in Cockermouth and Maryport ICC. Since then, it's expanded as a team and has grown to be able to partnership work with all 8 ICCs. And primarily that's our main focus as a team. It was to support our ICC colleagues, to raise awareness about the third sector and to ensure that they were making appropriate referrals via our team for individuals who would benefit from some additional third sector support.
I think what's been really key about my role, and particularly at the moment when our health and care systems have been really challenged, whether that be our acute hospitals, our home care services, our mental health services, is that we need to think very differently about how we provide services to patients and people in North Cumbria. And this role has enabled us to really broker some quite exciting and innovative conversations between our statutory deliverers, adult social care, public health, our acute hospitals, our community nursing teams, and importantly the third sector, so that we can work on developing new, exciting, innovative, very flexible, very different styles of services that really help to support not just patients but our systems as well.
My role within the team is as a third sector referral coordinator, and although the team support people with a range of health and wellbeing needs, the aim of my role is to work with people that primarily have emotional and mental health needs. So how I do that role is I make contact with people by telephone. We receive the referrals into the service from our NHS colleagues and from our social care colleagues as well, and make telephone contact with people. And it's a wonderful opportunity to have a conversation with the person, find out about what's important to them, and to see if there are any things that they would like support with, or things they want to change or improve the quality of their life. And I will do my very best to connect them with third sector organisations that will support them in their goals and hopefully meet their needs.
The most rewarding part is when you actually find that support and being able to just give that information to the patient, and in some cases we will make that direct referral. So for somebody who maybe doesn't have the confidence to approach an organisation for support, we can just be that bridge between the organisation and the patient and just make it easier for them to access that support.
So when I have a telephone conversation with the person, I will explain about the role that we provide here at Cumbria CVS and about the connections that I have with different third sector organisations. So it really depends on what the person tells me about what's going on in their life. So for example, it may be that they've got some financial concerns, or it could be that they're feeling socially isolated after a bereavement of their spouse or their life partner. It may be that actually the person's really struggling with things like anxiety and needs some support to manage their emotional well-being. And so from the information that the person provides, I will then link them with an appropriate organisation to meet that need.
Things that can be challenging is trying to keep on top of the things that are going on in the third sector. It's an ever-changing environment. And I think that's where we are important, because it means that the health teams don't need to stay on top of all that information. We can do that for them. And when a patient comes in to us, we will do some research for that patient, and that research will help to inform the information that we keep, so we can identify it quicker the next time round. But generally just trying to keep on top of all the amazing things that are going on in the area.
we've been able to use some of the real skills that the third sector have, some of the experience that we have in things like reaching right out into disadvantaged communities, the way that we innovate, the way that we really work at pace, and also some of the assets that we can bring to our whole system in terms of delivering health and care, things like our buildings, but also masses of experience and lived experience of people who experience health issues and also their carers as well. And I think what I've really enjoyed are those kind of light bulb moments when people within our health and care systems really kind of get and understand why it's so important that the third sector are involved in patient care and supporting people with health and care issues.
Clare Edwards is our Health Partnerships Manager for Cumbria CVS. She's been with the organisation now since 2018 and has proven to be a huge asset for not only Cumbria CVS but the wider third sector organisations across North Cumbria, and for our system partners within health, adult social care and commissioning. She's been able to forge some fantastic relationships over the last few years, which has proven to be very fruitful for partnership working.
In terms of developing my role, which has been a new role for the organisation, working with Clare has been invaluable because she has the most fantastic links, and working with different system partners and has enabled me to forge links with those partners as well, so that we can undertake the work that we need to do as part of the third sector referral coordinator team. So without her skills and knowledge, I think it would have been really hard for me to develop my role.
I've worked with Clare since the onset of the project. She's extremely knowledgeable about the health systems. She's very supportive, and most of all, she's really enthusiastic. So she's really good to work alongside, and it's you kind of get caught up in that enthusiasm. So enthusiasm and positivity is great.
Clare as a colleague is fantastic. She really is. She's one of these individuals that has just got that get up and go. She really does forge such strong relationships with anybody. She might say that it's never been easy. She always jokes that she's sometimes wearing the few bruises from banging her head against the wall, but no, she is a fantastic colleague, and we're very grateful to have her.
She does have an energy which is really infectious, so that kind of rubs off on the whole team, so that positivity is just great to be around.